Well, I'm joined now in the studio by Unni Krishnan from the Development and Aid Agency Plan International and the social commentator Isabella Lisk, who only last night was at a Médecins Sans Frontières briefing on the Ebola crisis. Thank you very much indeed to both of you for coming in. First of all, I'll start with you, Dr. Krishnan. The World Health Organization said earlier this week it was hugely impressed with Nigeria. It was coping very well with its Ebola outbreak, and then we hear that there are more victims. Does that worry you?
Yes, throughout this outbreak, since it started several months ago, the disease and the virus has been one step ahead of the response. It is true that Nigeria quickly acted and put some brilliant control measures in place through which they were able to limit the number of cases. Otherwise, it could have been an explosive situation. So there are two different things which we need to look at together.
Now, you were, Isabella, at a briefing
Yes.
only last night, was it?
That's correct.
I mean, what did they say at that briefing?
Well, the briefing was hosted by the Sierra Leone High Commission and by the Sierra Leone Diaspora Network. And really what it brought together were experts on the field from Médecins Sans Frontières. It brought the public health of England and concerned Sierra Leoneans from the diaspora. And it gave us a flavor of what was actually going on. It was a conduit for people to begin to mobilize and to come together and to sort of coordinate what they wanted to do, to see where there were areas of deficiencies and to get an update, sort of first-hand experience of what was going on.
One clear area of deficiency which Médecins Sans Frontières identified is the lack of leadership and the lack of skills, the sort of high-level skills that are required in this sort of environment to deal with that. I mean, is that fairly accurate, do you think, Dr. Krishnan?
Yeah, when I speak to my colleagues, Plan works in Liberia, Sierra Leone, and Guinea. One of the things which is coming out, this is 2014, but bodies are lying inside houses for several days because they do not have simple gloves and other materials to dispose the bodies. And what's happening is that children are touching the bodies, others are coming in contact. Please remember, Ebola can spread from dead bodies. So this is something that needs to be addressed quickly. And these countries have some of the weakest health systems in the world. And this crisis has added a huge burden. Unfortunately, the rich countries, rich nations are still sitting on the fence. They need to give more resources to these countries to fight the crisis in the best interest of the people in those countries as well as the people in the rest of the world.
No, you're absolutely right. And I'm just going to ask you this again because there's some brighter piece of news that two American doctors who are working in Liberia and who apparently caught Ebola have recovered and been discharged. I mean, are we able, I know this might not be possible to do, but can we definitively say that the drug ZMapp led to their recovery? Or should we be cautious and say that they had the sort of overall first-class medical care that's lacking in West Africa?
It's correct. First of all, without strong health systems, no medicine will work. It will continue. First of all, it's really good news that the two selfless health workers, doctors who have been there on the front line in the struggle and the fight against Ebola has survived. This is really great news, and that's really a source of inspiration for many people who are on the front lines. But please remember, this is a disease which is relatively new. We know less about it, and this is a medicine which is really new and it has not been tested in the past. So it's too early to conclude exactly what contributed, but these are unprecedented situations, so unprecedented moves are needed.
And they certainly give cause for hope, don't they? Now, Isabella, there have been border closures across Africa with some, travel bans in places like South Africa, Kenya, I think Senegal,
Yes.
Ghana has also been sort of stopping flights. The problem, of course, is that the borders with some of these countries is so porous that it will be impossible to enforce. And if anything, I mean, what they're really doing is restricting legitimate travel.
Yes.
Which comes through, flights and so on and so forth. And that could, of course, have an effect on attempts by the WHO to try and actually contain the disease.
WHO is not in favor of this. And in some cases, it seems like an overreaction. because some of these places you are supposed to screen, and if the emphasis is put on basic screening, then you should be able to screen out those who are unhealthy. Also, the economic factors. The borders are porous, so how well, if you would get yourself into a false sense of security if you think that by closing these borders alone are going to stop people from moving about. The Mana River area, which is Guinea, Sierra Leone and Liberia itself, this is what contributed to the spread of Ebola between these three countries because of such porous neighboring borders.
Now, Dr. Krishnan, the World Health Organization says it's drawing up plans to deal with Ebola over the next 6 to 9 months. I mean, that implies that a lot more people are going to die before they can arrest this disease.
It's quite possible. The best way to deal or predict the future of this outbreak is by inventing it. That's exactly where a plan dealing with the immediate requirement as well as the long-term requirements
and
has to be taken into account.
What's the immediate requirement?
Immediate requirement is care and support are needed for people who are infected. The second, psychosocial care and support is needed for those who are infected, as with the family members and the health workers who are on the front line. And the third thing is appropriate information. The panic or knee-jerk reactions are happening from possibly certain authorities as well as certain traders and so on, because they do not get scientific information on time. And it's really good to note that, channels like yours, you have got a good spread there in the footprint in that region, is bringing up really scientific debate on this. But otherwise, we keep seeing, exaggerated emotional news items, which is not helping people. So.
Absolutely.
Scientific information from credible sources. The presidents and the prime ministers need to come out more frequently on national television and radio to give reassuring messages, scientific messages, so that people can come forward to such health centers.
I have to agree with that. Médecins Sans Frontières, they did discuss that part of their program was not just caregiving, but sensitizing. And also part of the Sierra Leone diaspora identified the need to have a hub of credible information so that, a lot of the conspiracy theory, the mistrust can be dealt with.
Okay, Isabella Lisk and Dr. Unni Krishnan, thank you very much indeed to both of you for coming in.
Thank you.